Right, the minister will give you the updated confirmed cases. Mr. Li Guohua, please. Friends from the media, good morning. On November 22nd, at our tracing and testing close contacts, we found 2 suspected confirmed cases. One is working for the UPS freight station and is the confirmed case colleague. And also the other case, confirmed case, is his wife. So based on these 2 cases, we give them the NAT and results are positive. So based on the experts' idea, there are the clinical manifestations, CT image, and also the laboratory results. They are confirmed as the COVID-19 cases and are transported to Shanghai Hospital for isolated and centralized management and treatment. We conducted a wider scale epidemiological investigation, including the close contacts of close contacts, and also the related environment. Now I give you the more information. Case 1, Mr. Surname Zhao, 49 years old. Is the confirmed case is close contacts, and right now is under the centralized quarantine and already received an NAT with a positive result. Is the fatigue symptom, and also the CT scan also showed disease, and transferred to the Shanghai Hospital for treatment. And that case, personnel also worked for UPS. He lived in Zhangjiangzhen, Shunhe Street, 126 known community. The epidemiological investigation during the past 14 days, he paid a visit to the supermarkets, the vegetable markets. All these areas actually are locked down temporarily, and also conducted the disinfections. And the case 2 is the close contacts of the confirmed cases and received the NAT, and the result is positive. And he's coughing, and also the CT scan of lung also showed the inflammation, and also transferred the Shanghai Public Hospital for treatment. The case is the working for the customer service of the International Logistics Center, and also the wife of the Mr. Wang, the confirmed cases, and lived in Xinsheng community. Based on the epidemiological investigation, besides her working places, during the past 14 days, he paid a visit to KFC at the Kende Street, and the supermarket, and the milk tea store. All these related areas also locked down temporarily, and also conducted the disinfectants during the weekend. The confirmed cases that were released yesterday with the temperature 39 degrees Celsius, and also with the CT scan in the lung area, and also transferred to the designated hospital, and also worked for the UPS Shanghai. And the husband of the confirmed case lived in the Xinsheng community. Besides the working place, he, in the past 14 days, traveled to KFC, Kende Street, a shopping mall, and also the milk tea store. All these areas also in lockdown, and also received the cleaning work. So far, as far as 8 a.m. on the November 23rd, we have traced 55 close contacts of the 2 confirmed cases. They are right now in the decentralized quarantine and received the first round of NAT. All showed negative results. And also the close contacts of close contacts totaled 2351 received the NAT negative. For the related environment, food items received a sample selection, and around 378 samples were collected, received the testing, and the negative results apply to all the samples. Right now we are conducting the epidemiological investigation and make sure that everyone need to be tested and traced should be received the required work. I'll give the floor to Mr. Wu, friend from the media. I believe you still remember the previous confirmed cases at the Yingqian County actually is listed as the middle risk level places as of today. Yingqian County in the past 14 days, no new confirmed locally transmitted case. So based on the interagency mechanism and also based on the command center of the CDC and Health Commission, and the risk level is downgraded from middle to low level. Shanghai will continue our efforts to prevent imported cases and it's further spreading within Shanghai. And for us, our job is that we should make sure that we keep a good look at all the gates, and including our national gates, the gates to Shanghai, and also the gates to the schools, to the communities. Make sure that the disease prevention and control are conducted in a scientific-based and targeted manner. And we also keep a close eye on the specific personnel and the people for the different occupations, and also make sure we treat people immediately as required. And especially right now is the high occurrence season of the seasonal flu, so we will also tighten our efforts in this regard. So regarding the origin tracing of the confirmed case, I believe Mr. Sun can give you a better explanation. So regarding the confirmed case surnamed Wang, the November 9th, we actually traced and managed the close contacts of 28 people, and 190 close contacts of close contacts, and 51 of the general contacts. And we also look into 9,617 people related to this case, and they all received NAT with all negative results shown. And we also select the samples from his working place, living place, total 14280 negative in their testing. The Anhui CDC also reported that the working colleagues of Mr. Wang also confirmed as the COVID-19 case. And we also trace the close contacts of this confirmed colleague. Their NAT test is also negative. So what these tell us? That the inflammation source actually we looked into its background. So with our arduous efforts, based on our epidemiological investigation, so these two cases, before they're confirmed in the past 14 days, they didn't have any close contacts or a direct contact with the confirmed suspected cases of COVID-19 or asymptomatic cases, or even people treated and discharged from the hospital, or the people with fever. And they also no contact with people from the medium and high risk regions, and also the captain crews. So which means the human to human transmission is not an option for these two cases. And also before they confirmed as the COVID-19 cases in the past 14 days, they didn't consume any imported cold chain food. So cold chain food also not an option. But what we found that on October 30th, they entered and clean a container from the Americas. So it's a close environment, and also it's in a quite humidity environment, and also the scientific proof also showed that the COVID-19 virus actually can still alive in this kind of environment. And these two people actually during that time they didn't wear masks. So if we count that time, so actually it's in line with the incubation period of COVID-19, and also we found that actually their disease, the sequence actually is more or less the same as the gene sequencing from the United States. So based on all these elements and evidence, the origin of these two confirmed cases can be resulted to this freight tank and imported from the overseas, from North America. Thank you. Now the floor is open. From Shanghai TV. So for the middle risk area, what kind of measures we have taken? The Pudong new area, based on the requirement of disease prevention and control for the confirmed release of confirmed cases, suspected cases of COVID-19, and also the risk level of community, actually we have a set of standards and procedures in place. So first, when we received the information of the suspected cases, the new area of Pudong will locked to the community, the exact building, the exact household of that confirmed case or suspected cases, as well as the total number of people and household related to this case. And we also have the plan in place in terms of the medical personnel and also the supporting staff to help us conduct the following up. So when we confirm the case, and we will conduct the lockdown management, and also we will let everyone involved to receive the NAT and also conduct environmental disinfections during the weekend. And we also inform the household they need to test their temperature twice per day, and also they need to report every day. And we also have a detailed plan to support people's daily necessity, and also the people working at the grass level should also to pay the door-to-door surveys for further explanation. We also have the confirmed cases in the hospital, so that the hospital is also right now managed in a loop, in a closed manner, and we also sent an expert team from the local health commission and CDC. They stationed right now in the hospital for frontline guideline. So they closed the gate of the hospital for the people or items going outside the hospitals. They should also go through a certain level of inspections. And also we talk about the in the hospital building with the confirmed cases need special efforts and attention, and we also conduct the all-round disinfections, and we also emphasize the PPE and also personal protection in the hospital. And the second, for the staff working for this hospital, they all received an AT, and we, in a very faster speed, to lock all the related and close contacts of the confirmed cases. Right now, we already gave 2 rounds of NAT. The results of the first round is all negative. For the second round, we're waiting for the final results. And the 5th days, the 7th days, they will also receive another 2 rounds of NAT. And third, we also emphasize the security of the treatment in the hospital. So first, they should protect themselves while in the hospital, and the second, they need to give a quality treatment to the in-hospital patients. We also have the nosocomial management personnel, and also for people in the hospital, they received customized treatment. And we also have the A3 emergency operation room, make sure that we meet the immediate emergency needs, medical needs as well. And we also have the hotline 24/7, and we also provide the psychological counseling service. So make sure people not in anxiety. So my question regarding the treatment of the confirmed cases, and also what's your suggestion to the public? Thank you for your question. I believe everyone actually quite care for that 5 confirmed cases since 20th of November. So the later 4 cases actually were the close contacts of the first case. So we found them in the close contact tracing. And we found actually these 5 cases that showed symptoms such as a fever, coughing, headache, fatigue, and or loss of the gustation, and also the smell sense. So also based on their CT scan, they also show the inflammation. So right now, these 5 cases actually are the confirmed cases with normal symptoms, and right now they receive the centralized treatment. And we also have the cross-department and also the interdisciplinary department experts to give them the customized treatment. So we give them the optimization treatment as well as the combined treatment of the traditional Chinese medicine plus Western medicine, and we also look closely to their body indication. Right now, so far, these 5 cases is well controlled. The process of the disease is well managed and controlled. So the suggestion to the public, first of all, protect yourself well. So if you showed any symptoms or are not feeling well, you need to go to the fever clinic ASAP. Especially if you have the coughing or fever system or diarrhea or loss of the taste and the smell. Please report yourself to the nearby fever clinic for further treatment. And also, please wear masks. Please always carry a mask with you. If you take public transportation or go to a population high density places, or you pay a visit to the hospital, please wear a mask. This is the top priority. And second, keep your hand hygiene. Wash your hands frequently. Like if you touch your mask, like put it on or take it off. So please wash your hands, and also the before eating or the throwing your waste. Keep your hand hygiene. Use the soap or the sanitizer. So we have that rules to teach you how to wash your hands carefully. Please follow that standards. At least wash for 20 seconds, and also to wash your hands with the running water. So this is very important. So to keep this really good habit. And we talk about for sneezing, please make sure you cover your mouth and nose. Either use a tissue or use your elbow to cover your mouth and nose. And for the tissue, after use, please throw them in the garbage bin, and also please wash your hand. And before washing your hands, do not use your hand to touch your eyes, your nose, and mouth. And also please keep social distancing, especially you go to the mass gathering places or the public area. Please keep the social distancing. So please keep a good hygiene and also follow all the rules and the regulations. I believe everyone can protect yourself well, and nothing can really change your daily life. Thank you. So my question regarding to the freight station at Pudong Airport, because recently the confirmed case is actually all related to Pudong Airport. So regarding the working staff at the Pudong area, especially Pudong Airport, are the confirmed cases. So the freight station and the Pudong Airport has great importance, and we conducted immediately the tracing work, especially the close contacts and the close contacts of close contacts. So this is just a freight area, not related to the terminal area. So we also organize a specific team in order to further implement the disease prevention and control at the freight station area. So all the imported freight would go through the inspection process. And second, regarding the cold chain food, so we have the two centralization measures. So we make sure that the people working for the cold chain food, they work, live, rest in the centralized places. And also the cold chain food should also transported and stored in the centralized places. And right now we also issued the 4th edition of the disease prevention control practice guideline, and we further standardize the working procedure and the process of the freight service. And we also, for the people working at these areas, they all received an IT. 17719 people receive NAT. And so far we received the result of 11,544. The rest 6,175 results will come out in a short time. So far, the test result is all negative. So also appreciate people's great support and understanding. And also would like to say a big thank you to all the medical staffs. Going forward, the Pudong Airport will also intensify our efforts in terms of disease prevention and control in the fall and winter season, especially the people working on the front line in this risky, higher risk level. And also we will give a vaccination to the people working at the front line. And we'll also conduct the environmental disinfections on a regular basis. Thank you. So my question regarding to the management and inspection endeavor of the cold chain imported food. Thank you for your question. We will continue our efforts in managing the imported cold chain food and also to make sure our practice in a normalized manner. And we also sent a specific team to conduct the inspection. 177,000 companies involved in this regard received our inspection. And we will continue to send a law enforcement team to conduct our inspection, to look into the companies involved in this regard, as well as the food processing companies, and make sure that the people working in all these areas to protect themselves. In the recent period, the different cities in China all showed the confirmed cases related to the imported cold chain food. So that also actually require us to conduct a further management of the refrigeration house. And we also take into consideration of all the people in the logistic chain, and including the food processing, imported, transportation, and selling areas. For larger size of the refrigeration houses, we also have the people stationed there and also collect samples. So far, we take samples, and also the result so far is all negative. So we will further conduct the inspection job and make sure the every stations or links related is all in our management and monitoring. And also make sure the movement of the cold chain food is managed in a closed loop manner. And on November 16th, we also set up a intermediary inspection plates, which means that the imported cold chain food need to receive the NAT test at these intermediary service places, and also need to be cleaned for their packaging. So this realized the concerted efforts of a custom and also people working for these intermediary service center. So the food that without receiving the green pass from the custom, they should all be cleaned and receive the NAT at these intermediary plates. And also we talk about the storage place that the related owners, which means the transportation company or the refrigeration house, should take responsibility. And they should also record the information of all this imported food. And at each refrigeration house, they should also establish an isolated place to restore the imported cold chain food. And also the specific working team from the market supervision department should give the NAT test. So far, we have selected a first group of the intermediate service company, that's 434, and they will provide the inspection service to the imported food. As of November 22nd, 336 vehicles of the food transported to these places. More than 3,000 samples collected and tested, and so far the results we got were all negative. Going forward, we'll conduct the end-to-end process management. First, the market supervision department will conduct the services and also the inspections in the logistics as well as these immediate service centers. And second, we will also conduct the monitoring on the packagings, especially the specific places like the supermarket, the wholesale market, the food market, and the farms market, and also for the places to restore, process the aquatic products as well as the meat and husbandries. They should collect the samples and also test these samples as needed. And third, we also monitored the related companies, make sure they shoulder their responsibilities to conduct the investigations and also inspections as well as the disinfections to their working places, the imported food, as well as protect their people. Regarding a people's question about how to buy a secured cold chain food, we suggest the consumers first, please go to the legal supermarkets, the grocery stores, or the farmers market to buy this kind of food. And you can check the tracing code online to know their trace history or the origin of the imported food. And the second, I would also suggest that you should protect yourself. First, you need to wear masks, wear gloves, do not touch the cold chain food by bare hands. And if you buy this kind of food online, you should check their quarantine information and also clean the packaging and also clean your hands. When you clean the cold chain food, make sure you separate the cold food and the cooked food. Make sure there are no cross infections. And fifth, when you consume the cold chain food, please make sure you well cooked all these foods. Thank you. One last question. So regarding the transportation service, actually there is no big change to the arrangement. And also please follow our information released from the authorities. Thank you all.